Let's go to the topic, diagnosis according to Qi, Shui, and Jinyi imbalances. Shui stagnation. Blood should flow freely and unhindered throughout the body. Blood can stagnate for a variety of reasons. Blood and Qi have an extremely close relationship, with blood being dependent on Qi for its movement. This means that Qi stagnation can directly result in blood stagnation. Qi deficiency can also be a cause of blood stagnation when Qi lacks the strength to circulate and spread blood. Blood deficiency can, in this way, also be the cause of blood stagnation. The movement of blood can also be blocked by phlegm and by physical traumas, including surgery, because when there is a physical trauma or surgery, blood will leave the vessels and no longer be circulated by Qi and will therefore stagnate. Heat can coagulate blood so that it becomes sticky and clots. Cold can freeze and congeal blood. Just as phlegm and dampness have none of the moistening or lubricating qualities that Jinyi has, blood stagnation has none of the moistening and nourishing qualities that physiologically blood has. In fact, stagnant blood blocks the passage of Qi and blood in the culi and thereby prevents fresh, nutritious blood from circulating to or through an area. Therefore, some of the symptoms and signs of blood stagnation and blood deficiency can be very similar. There is, though, a significant difference between them, which is that the signs of blood deficiency will be limited to a very localized area and will not be systemic, unlike in blood stagnation. The treatment of blood stagnation is often relevant in elderly patients. This is because blood stagnation is part of the aging process, and blood stagnation is often a consequence of most chronic imbalances. The consequence of blood stagnation can often easily be observed in elderly patients. Their movements can be stiff and painful, and they often have visible signs of blood stagnation in the form of spider navy and visible purple capillaries in the skin. As we saw with phlegm, blood stagnation is very common but is often overlooked in diagnosis. This is because, like phlegm, the symptoms and signs that are described in Chinese textbooks are crude and slightly oversimplified. In reality, a diagnosis of blood stagnation will be based on many small signs and symptoms that are less tangible and thus more difficult to spot unless you consciously search for them. One of the main symptoms that Chinese textbooks defines as being characteristics of blood stagnation is pain that is stabbing, sharp, or piercing in character. The pain will be fixed and localized in a specific place and will not move about. The pain has this character because blood stagnation creates a physical blockage preventing the movement of Qi, blood, and Jinyi. This results in Qi accumulating in a small and limited area because it cannot circulate here. Where there is stagnation, there is pain. The pain in blood stagnation is unlike Qi stagnation pain. Qi stagnation pain is more fluctuating and less fixed. When there is Qi stagnation, there will be stagnation in a much larger area, but Qi will move about within this area. It will mean that the pain is more undulating and spasmodic. The pain will also be able to move slightly from place to place, and Qi stagnation will manifest with a tense or distended sensation. Blood stagnation can manifest as physical accumulations, lumps, or hard knots in the muscle or tissue. This is because there is a stagnation of a physical substance. Fibroids and myoma are examples of blood stagnation, but it is important to remember that phlegm can also create lumps in the tissue. This is because phlegm is also a physical substance. The difference between lumps and accumulations that are manifestations of blood stagnation and phlegm is that blood stagnation accumulations will be harder and have more clearly defined but rougher edges. Phlegm accumulations are less clearly defined and are smoother. Furthermore, blood accumulations will be more painful. The menstrual cycle is dependent on blood flowing freely and unhindered. Blood stagnation will therefore often manifest with a disruption of the menstrual cycle. The cycle may be longer because blood does not flow freely and thereby stagnates in Chiang Mai. There can be dysmenorrhea and the menstrual blood can be dark and clotted. There can also be a heavy or extended bleeding, with the bleeding continuing for longer than normal 4 to 6 days. Blood stagnation can be a factor in bleeding anywhere in the body. This is because stagnated blood will create a blockage in a vessel. This will lead to an increase of pressure in the vessel because blood and Qi cannot get past the blockage. Eventually, the pressure becomes so great that the wall of the vessel ruptures. When there is bleeding, whatever the cause, the bleeding will itself become a further source of a blood stagnation, because when blood exits the vessels and channels, it will no longer be circulated and governed by heart Qi. It will then stagnate and further disrupt the movement of qi, blood, and jinye. The heart has a function of governing blood and can easily be affected by blood stagnation. This will manifest as a sharp pain in the chest and disturbance of the cardiac rhythm. Stagnated blood does not have any of the nourishing qualities of blood. On the contrary, blood stagnation blocks fresh, nutritious blood from circulating through an area. This can result in the skin above an area where there is stagnated blood being dry, flaking, or thickened. There may also be changes in skin pigmentation. By blocking the circulation of blood in area, blood stagnation will prevent Shen, which is anchored by and thereby circulates together with blood from flowing through the area. This can result in a sensation of numbness. This is typically seen when there is a scar tissue. The stagnated blood from the trauma or the operation will have accumulated in tissue around the operation site or the injured area. The tissue is often hard and thickened, and there is either numbness or sensory disturbance in the area, all of which are characteristics of blood stagnation. Stagnated blood moves more slowly, if at all, and is therefore less oxygenated. This can be seen in generalized signs such as a dark facial complexion, dark lips, dark or purple nails, purple tongue, and swollen veins on the underside of the tongue. Wherever there's tissue, skin, or blood vessels that are purple in color, this will be a sign of blood stagnation. Typical examples of this are bruising, varicose veins, and spider navy. The pulse can be choppy, wiry, or confined when there is blood stagnation. It can also be knotted if there is heart blood stagnation. On the mental emotional level, blood stagnation can impede the movement of Shen. This may mean that the person is psychotic or depressed, or that they may have difficulty staying awake. A way of testing whether someone has blood stagnation is to fold their ear and squeeze it tightly together with your fingers. The more stagnation of blood there is, the more painful it will be. You can also press your fingers into the skin in area where you suspect that there may be blood stagnation and then release them again. The more stagnation there is, the longer it will take before the white imprint of the fingers and the color of the skin fades away. Thank you for your attention.